subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us once again Dr. Sheetal Goyal. Dr. Goyal was with us a few months back, but at that time she was wearing the hat of a neurologist. And today we've asked her to come in as a yoga expert. You know, next week is World Yoga Day, and we thought it would be good to have a medical practitioner, a doctor, to come here and speak about yoga. A little about Dr. Goyal. She is a well-known senior consultant neurologist in Mumbai. She has done her MBBS and MD in internal medicine from Guwahati Medical College and a DM in neurology and a PDF in Cognitive Neurosciences from NIMHANS in Bangalore. She has to her credit both national and international publications. She has also obtained several training in the treatment of various memory and movement disorders, deep brain stimulation, etc. And as I mentioned, she is a certified yoga instructor. She's a certified Raja Yoga trainer of heartfulness. She has done several certification courses, of which the prestigious one are the VEEG certification by the Indian Epilepsy Society and a one-year learning course by the World Headache Society. She's also trained in Botox injections given for writer cramps, cervical dystopia, blepharism, spasm. She is also a consultant neurologist in NIMHANS Super Specialty Hospital in Guwahati and the Apollo Clinic in Guwahati. She is currently working at the Wockhardt Hospitals in Mumbai Central, Mumbai. Welcome to Health Live at Seniors Today, Dr. Goyal. How have you been?
Hi, everything is going good. Thank you so much for giving me this opportunity.
Thank you very much.
To talk on neurology. Yes.
Yeah, you know, we have we conduct a variety of programs every day, and we do have sessions on yoga that are conducted. But I think we've lost Dr. Goyal, but we'll get her back. Yeah, right. Yeah. So as I was mentioning, that we have had we conduct a lot of events every day through the week, and part of that has been there are sessions which are conducted on yoga, but it's what we were looking for is a medical practitioner, is a doctor to come in and talk about yoga and specifically look at from the medical point of view as to how one looks at yoga to as an aid for improving the health of people. And given the fact that you are a neurologist and you are with a leading hospital of Mumbai, it makes a lot of sense to have someone like yourself to talk about yoga. So without any further ado, I'm going to throw it open to you. I know you have a presentation. So while you do the presentation, if there are questions that you have, first of all, while you're doing the presentation, don't ask questions. But if you have any questions, please put them on the chat, on the Q&A tab. As always, put your gender and your age so that we can ask a more considered question. We will only address questions on yoga and not on neurology. Sorry, doctor, but I think we should stick to yoga this time, and let's look at that. Over to you, doctor.
Yeah, thank you so much. So I'm Dr. Sheetal. Thank you for such a kind introduction. This is the second time that I got an opportunity to be in such a great platform. So today I'm very specifically asked to talk on, if everyone can see my slides, right?
Yes, we can see.
So why I am chosen among so many doctors to give a talk, I'll just give you a brief introduction. It's 18 years I'm doing meditation under heartfulness, and from 7 years I am a Raj Yoga trainer. So they chose me, and so I'm here. So my content of the talk will be very simple. Today I want to today I'll not be able to tell you ki haath upar karo, do your hand up, do your leg up. It is not possible in Zoom per se, because I'm not directly going to teach you yoga. But yes, I'm going to give you some very technical knowledge about yoga and the misconceptions that we have about yoga. So my content will be on the 8 limbs of yoga, the importance of each yoga, what are the cautious points if you're asking your elderly, your grandparents to do yoga, and I'll give you some yoga tips for hypertension, diabetes, and finally I will summarize. So coming for the yoga, so everyone has got a misconception that yoga matlab you have to do exercise. Yoga means you have to keep your hand up. Yoga means you have to put your head down and leg up. So there is always that yoga is very directly related to physical exercise. But I want to tell that yoga is more than that. Yoga means union, integration, and oneness of both your inner and the outer state of being. Why it is important is that when you will see maximum of the patients who visit psychiatry department, who have psychiatry issue, if you sit with them and listen for some time, you will realize there is a discrepancy. There is no unity between their outer expression and their inner self. So yoga brings the integration between these two. We cannot be saintly on the outside and be greedy inside. So basically yoga teach you to be one. How जैसे बाहर हो वैसे ही अंदर रहना सिखाता है. That lack of integration is not natural and it leads to personality disorder, as I have always also mentioned just few minutes back. Ultimately, there is no inside outside, but this is pure you. If this is Sheetal, this is my nature. If you see inside, I will be the same which I am talking to you. So that integration is maintained when you do yoga. Why I was using again, why I started telling that I will tell about 8 limbs of yoga. This is known as Ashtanga yoga. It came from Patanjali. Many thousand years back, there was a Rishi Patanjali who gave us a lot of knowledge on yoga. So he told that Ashtanga yoga, Ashtanga means 8. So he told that there are 8 yogas that a person should practice if he really want to be a spiritual person and he want to change his living lifestyle. So he told that it starts with Yama. The first limb of yoga is Yama. We'll know about each one of them in a brief note, so that by the end of today's talk, you will know what actually yoga means and you don't have that misconception that if you go to Patanjali Yoga Center, then only you can do yoga. So first comes Yama, then comes Niyama, then comes Asana, then comes Pranayama, then Pratyahara, Dharana, Dhyana, and Samadhi. So these are the very key and beautiful journey that one takes in the life when they want to undergo spiritual living. So asana, if you can see, the third limb of yoga is something which we always misconcept that this is the only thing that we deal with when we speak about yoga. So coming to the first limb, that is Yama. So Yama is the first limb where Patanjali Rishiji tells us that it tells you the idea about what you are not supposed to do. So coming to directly to the slides, in Sanskrit, Yama means regulation or self-discipline. So Ramchandra Fatehgar, he was one of the spiritual guru, well renowned some 100 to 200 years back. He told that giving up untrue feelings and untrue thoughts is Yama. So the first step in spirituality, which Patanjali Rishiji has taught us, is that you should accept Yama in your life. Yama means self-discipline. All unwanted things, unwanted desires should be given up. So this is simple Yama. To summarize, what they did is that he told that in Yama, there are 5 sub-limbs that comes. That is Apigraha, Ahimsa, Satya, Asteya, and Brahmacharya. So basically it tells us कि अपने से सच रहो, be truthful to yourself, be honest to yourself, be moderate with all your senses. If you want to eat, you liked something, it doesn't mean that you should eat too much. You should overeat because you liked that food. So there is a moderation in all your senses. You're eating, you're smiling, you're looking, you're touching, everything should be moderated by you. And ahimsa, obviously, non-violence, which we always kept hearing with Mahatma Gandhi's teaching. Then come our second limb of yoga. That is Niyama. So Yama tells what you are not supposed to do, but Niyama says what you are supposed to do. So Niyama says that please accept Santosa inside you. Whatever you have, accept it. See, those who are reading Bhagavad Gita will understand that whatever I am saying has been already incorporated in the story of Bhagavad Gita, which we go through. The sculpture that we have in our Hindu mythology. I'm just trying to keep it in terms of Patanjali's yoga. So what niyama the Patanjali ji has told us to adopt is swachh. Be very pure from your heart, your body and your mind. Be santosa, be very acceptable, whatever you get. Tapassa, always try to remove the impurities that you have that is creating difficulty in you and your near ones in the society. Swadhyaya, study of the self. You should know what you are, what is your advantage, what is your disadvantage. This will always prevent you from taking undue actions. And then ईश्वर प्रणिधन, where is that for everything. जैसे कहते हैं जो भी कर रहा है ईश्वर कर रहा है, which we always, our parents has taught us from beginning. This is among one of the sub-limb of niyama, where it says that surrender your all the activities to God, to Almighty. So here comes the niyama. Then comes the third limb, that is asana, where everyone thinks that asana is nothing but equivalent to yoga. So this is the third limb. Here, how to proceed when someone wants to go for asana, especially for elderly, because my talk is specifically for elderly, right? So whenever you are planning to do asana, which is the third limb of Patanjali, wake up early, drink at least 1.5 to 2 liters of water in early morning. To warm up, you should learn Surya Namaskara. I will talk about it. Then you do asana, which is nothing but it helps you to stretch up your different parts of the body. Then pranayama, and ultimately you go for mental peace and joy by doing meditation. So this is the Surya Namaskara. Surya Namaskara has got 12 different positions that a person adopts when he do. I'll tell you, people must be finding me so funny that a neurologist is talking about its importance, but I'm telling you every asana that is in Surya Namaskara is done by an individual has got its own benefit. So if a person regularly do all these 12 positions and do Surya Namaskara in the early morning, I can ensure that you're not supposed to do any kind of other asana, because the entire asana is a combination of these 12 asana. So what are the benefits? I have just kept across important benefits that are, it helps in blood circulation. It enhances the function of your digestive system. So anyone has got digestive issues, they can try with the Surya Namaskara. It also helps in weight loss. Very great. It helps in detoxification of your body. It helps in lowering your body pressure. Then glowing your skin. For every girls, I'm telling you can try with this. Help in muscle and joint strength. It calms you down. You know, when you are starting anything in your day, like you have bought a new house. So what you say, you always pray to God and you try to be calm at that moment because it is a precious time. Similarly, when you start any new day, if you do Surya Namaskara, it calms you down from within. So whatever activity you do in your daily activity, it always brings lots of calmness. It sustains you throughout the day with lots of calmness. It activates the heart, solves the BP problem and heart problem. So you can see the various 10 important things for which every people are suffering nowadays. It can easily be resolved if you learn the technique of doing Surya Namaskara. I want to warn everyone, don't go with my photo and start it from tomorrow. Go in detail about how it is done, because wrongly done will create lots of it will, instead of giving benefit, it will trouble you. So please learn how it has to be done and then go with it. So asana, again, I say it is the third limb of Patanjali's Ashtanga Yoga, is probably the most popular, but least well understood. Why I am saying least well understood? Because if you see, no, they all are always in their physical benefit. They will always say, ki, if I do this, I should have this physical benefit, this. But you know, if you see the Sanskrit meaning of asana, it means to sit. When the word asana was given by Patanjali ji, the man, unka maksad, his thought was that asana means to sit quietly and meditate. So when a person sits, that is asana. But then we found out many other postures which give benefit to lots of different troubles like liver disorder, kidney disorder, BP, sugar, and therefore asana started expanding. So basically, if you see from Sanskrit literature, asana means the position in which you sit and meditate. These are the different asanas that was given by Patanjali ji. This was so if you see on the left upper side, the lady, which is known as Parva Uttasana, it usually helps you in maintaining your digestion. So these are very common. I'll not go in detail with everyone. There are all very easy steps anyone can do if they don't have any gross abnormality in their body. If you adopt this 6 asana in your daily activity, it will really help you apart from your Surya Namaskara. The middle one which I have given is the asana which is accepted for meditation. So now when you will say that Papa or Grandpa, you need not do this asana, when you will know about it. So there are certain things that you have to be careful about. Though all the asanas has its all benefit, but as you grow older, sometimes your knee has got some problem, you have severe spondylosis, you have heart issues where you cannot go for aggressive exercise, otherwise it will lead to cardiac attack. So you have to be very careful. So you have to see your grandpa, grandma, or the patient himself that they are not becoming too short of breath while doing these asanas. They're not feeling dizzy when they are doing the asanas. They're not experiencing sudden weakness. If they experience any of these are red signals. So you have to avoid those asana from their daily practice. Certain asanas which are approved for management of hypertension, I thought I should keep forward. So this is known as Balasana. I'll not go in detail. I think the slides will be shown, given to all of you in YouTube. You can have a look. So this is a Balasana, which is known to improve the hypertension. Then we have got another asana, which is known as Savasana. We can see simply you have to lie down, relaxed, with a very calm breath and keeping your palms towards the sky. Then this is another asana, which is known as Virasana asana. Again, I say, see, all the asanas which I'm naming has got very fundamental way to do. If you go beyond that way and you do a wrong asana, instead of giving you benefit, you might end up with some other trouble. So be very smart when you are doing any kind of asana. This is known as Virasana asana, which is also known as hero pose. Then we have got another asana, which is known as Janu Sirsana asana. Okay. Then there is another, which is known as Baddha Konasana, which is known as bound angle pose. You must be seeing many times in news channel and all when Patanjali, they come for the yoga, they will always do. This is known as also butterfly pose. Nowadays, I have seen even small children doing it. They will sit like that. They will catch hold of their knee and they will keep moving their knees. This is known as butterfly pose, which is really very helpful for hypertension. Then this is known as Paschimottanasana pose. If anyone has attended my last lecture, this pose is also very important for dementia patients. Those who are losing their memory, if they are able to sit in this pose, this will always, these are known to enhance cognition as well. So this is a very nice pose both for hypertension as well as memory disturbance. Then there are certain yogas or poses or asana which is known for diabetes. This is known as leg up the wall pose. Go, whenever you get up, go to the wall, put a pillow in back and sleep like that for few minutes. It is recommended to be in this position for 10 minutes. It is told to improve diabetes. This is reclining bound angle pose. This is shoulder strain pose. It might be difficult for newcomers, those who are not doing asana never in their life. So don't try very high-fi, go with very simple poses. This is another pose. You must be seeing children doing this. Children do it because of fun, but I'm telling you, it is one of the very important pose which prevents diabetes in future. So if your children is doing this, don't stop them from doing it. Let them keep doing it. Then we have got this upward facing dog pose. It also helps in diabetes. And then we have got Aradhana Matyensdrasana pose. So this is also known as half load of the feces pose. Very beautiful pose. If you can do it, you must be seeing all the actors doing it in TV. So this is this pose. This also helps in calming you down. Also helps you in maintaining your sugar level in blood. So these are some of the asanas. So here comes the end of third limb. So today when I was told to speak about yoga, I thought that I may not be able to show my hand up, down and ask you to be in the carpet and start doing this. So I thought, let me educate you all that what are the misconceptions that yoga is equivalent to asana. It is only one of the third limb of Patanjali's Ashtanga Yoga. Then coming to the fourth limb of yoga, that is known as pranayama. So pranayama again comes with the combination of two words, which is known as prana and ayama. So it is the word prana is derived from the Sanskrit word an, which means to move or to breathe with the prefix pra, which generally is used to intensify the meaning of the root with which it is associated. So I'm not going to read each and every line. What I want to say is that when someone is doing breathing exercise, any kind of breathing exercise, they are also doing one form of yoga. And this is nothing but pranayama, which is the fourth limb of Ashtanga Yoga described by Patanjali Rishiji. Then what is the purpose of this pranayama? So I will tell you about one very important pranayama, but let us know what is the original purpose. So the original purpose of pranayama is to regulate your breath. I tell you, being a doctor, many times when patient comes to me, I can find out whether patient is anxious or patient is calmed down by the way they breathe. Whenever I hear them breathing, though they are sitting next to me for 15-20 minutes, I always tell them, I think you need to do exercise because you are not breathing healthy. If a person is breathing healthy, you will usually find them very calm. You will not be able to hear them breathing. So the original purpose of pranayama is to regulate the breath. When you do pranayama, your breath becomes slow, subtle. Hardly anyone can hear you breathing. In order to allow the attention to turn inward, calming your mind. When you learn this art, you also calm your mind and dissolve scattered thinking pattern. So those who have a very silent, slow, subtle breathing, somewhere the calmness is there within them and they can also concentrate in their business and everyday purpose. So this is all about pranayama. So when I say about pranayama and I don't speak about Surya Nadi or Chandra Nadi will be a gross mistake from my side. So I thought that let me talk on this. So you see, you have got this, okay? This is there. So this is right and this is left. You have to remember the left nostril is a parasympathetic. Now you will say, madam, what is parasympathetic? We don't know. So whenever you want to be very calm, you want to be quiet, or you want to be very creative, your left nostril Chandra Nadi should be practiced. And whenever like you are in the morning in the office and you're feeling very tired and you want to activate yourself, then Surya Nadi exercise comes into practice. So what you have to do is that whenever you want Chandra Nadi practice to be done, you have to close your right nostril. From the left nostril, you have to take deep, slow breath. And then you have to keep it inside for like 1, 2, 3. You have to count till 16. And then slowly you have to close it and you have to exhale from your right nostril. Whenever you will practice Chandra Nadi for 5-10 times or 10-15 times, it will calm you down. Because the parasympathetic system, which is responsible for the calming effect of the brain and the body, comes into play. But if you want to be very hyperactive, you're going to give a talk near anyone and you want to be active and you're feeling very sleepy, then try with Surya Nadi. It is just opposite of that. You will close your left nostril and take breathe from your right nostril like that. Again, you will keep yourself calm, neither inhale nor exhale for some 8-10 seconds, whichever is feasible for you. Then you will close it and you will exhale from your left nostril. This is known as Surya Nadi exercise. It is a part of pranayama which will help you to activate your parasympathetic and sympathetic activity according to in what state you are. Okay. So this is about this. Then there are many other exercises. You must be knowing from Patanjali's yoga. What they do is that they will take deep breath inside and then they will close it and they'll make a sound and they will exhale. So this is also one kind of exercise that we do in pranayama. So not to go in detail, I'm just giving you overview of all kind of yogas. So coming to our another limb of yoga, that is the fifth limb of yoga, is pratyahara. You know, pratyahara is, this is the most neglected part of one's life or something. Pratyahara among the 8 limbs is considered to be most neglected, but I tell you it is most important. Pratyahara is something where they speak about the refining the attention and aligning the senses inward. But why pratyahara is important? The lack of pratyahara is a reason why many of us struggle with meditation practice, and also why we don't benefit as much as we could from the practice of asana and pranayama. Many times patients know, like you see, whenever I teach them meditation, the first thing they come and tell me is that, Madam, बिल्कुल जैसे आग बंद किया, as I closed my eyes, the thoughts started wandering in my brain. I'm going to have a meeting tomorrow. Entire meditation, I was thinking what I am supposed to prepare for meditation, blah, blah. It was so disturbing. It was so disturbing. So, you know, this is because you have not won over pratyahara, which is the 5th limb of yoga. So pratyahara has a very important place, whether you do asana, you do meditation, you do pranayama or whatever. Pratyahara has to be enrolled in your life. So how Vivekanand has described Pratyahara. So he has hold to the idea that I am not the mind. I see that I am thinking. I am watching my mind ache. And each day the identification of yourself with thought and feeling will grow less, until at last you can entirely separate yourself from the mind and actually know it to be apart from yourself. I don't want to describe this writing by our great Swami Vivekananda. What I want to say is that, no, usually, if you can see down, I have given a photo. When I do meditation, no, or when my any patient, any abhyasis do meditation in front of me, and they say I have lots of thought. So what we do, no, we play during the meditation. Whenever the flow of energy is towards the heart region, if you can see down, there is a L. The up there is Z. So Z is known as Chit Lake, which is the highest center for consciousness. And down there is an heart region, and on the opposite side, on the right side, you can see the Atma Chakra. So it is seen when a person has got lots of thought, the entire energy flow towards the heart region. So when a person who is continuously meditating, we can record the energy flow, we will realize that instead of going to the heart region, the thought goes to the Atma Chakra. And as it goes to the Atma Chakra, the patient's thought disappears and patient becomes silent. And the meditation goes deep. So this way, Pratyahara can be won if you regularly do meditation. So being a heartfulness yoga trainer, it is told that heartfulness meditation, cleaning and prayer, these 3 which we teach all our people who want to do meditation, Pratyahara is developed in that individual, and they can do meditation much better than what they used to do earlier. So we have till now we have discussed about the 5 yogas among the 8 Ashtanga yoga of Patanjali. So what are those? Those are Yama, where we are taught what we are not to do. Niyama, where we are taught what we are supposed to do. Asana, different postures that we attain during our exercise. Pranayama, where we do breathing exercise. And Pratyahara, where we get control of all our 5 senses and we indulge in meditation. So each one has its purpose, and together they help to refine our thought, our action, our posture, our energy, including our breath. All this prepare us for a very sound and deep meditation. So basically, I'll tell you, this doesn't have, you cannot tell that Yama is my goal, Niyama is my goal. Actually, these are all the preparatory phase. If you win over this, then next step comes your meditation, which is a pure Raj Yoga meditation. Then comes dharana, dhyana, and samadhi. When I say that I do yoga and I am doing meditation, they say, Madam, yoga is different, dhyana is different. How can you bring both all these things together? But again, I am saying dharana, dhyana, samadhi is also the last and the final limbs of yoga described in Ashtanga Yoga by Patanjali. Why I am telling all the three yogas together is because there is no clear separation between them. They are very much interlinked among themselves. So what is dharna? धारणा मतलब बोलते हैं ना एक धारणा लेके बैठना. You think about something and continuously you keep thinking about it is dharana. So it is a refining the thought process, aligning the flow of intention inward towards the center. Then what about, I'll just give a brief, I'll not go in detail, but you should know what is dharana, dhyana, and samadhi and how they're different from each other. So dharana is a process where the mind holds to some object, either in the body or outside the body, and keep itself in that state. Anytime you will see jo tapasvi the, the rishis of past who were too much engulfed into the meditation, where even if they are opening their eyes, they eating something, you will see a spiritual essence in them, because they used to keep that condition holded in them. So that is dharana. So whenever there is a broken flow or uninterrupted stream of knowledge in that object or part of the body, then it comes dhyana. Dharana is just till you are keeping it with you is dharana. But if you continuously maintain it, is dhyana. And once you are into depth of dhyana, you attain something which is known as samadhi. Now again, everyone will be making fun. Yes, samadhi? No one wants samadhi. I want to stay in this world only. So I'm telling you, samadhi has got a wrong conception in TV serials or something. Samadhi means you are dead. No. Samadhi means you are in a very deep state of meditation. So dharana, dhyana, and samadhi goes hand in hand. So I'm not going to go in detail, but when you combine all these three, we know it as samyama. Okay, so, you know, Vivekananda, many times we keep reading that he was enlightened, you know. So, you know, when you master these three beauties, dharana, dhyana, and samadhi, if any individual, what is the ultimate result is the inner consciousness, the light of knowledge, transcendental insight, and higher consciousness. When anyone attains this state, no, they don't have to read any kind of books for spiritual gain. The spiritual knowledge starts coming from within. So this is the highest form of spiritual attainment that a person gets after doing lots of meditations and dhyana. So coming to summarize, the first 6 limbs contribute to that journey. Though the first 6 limbs basically helps you prepare you for the last 3 limbs. Yama, as I told you, is the process of removing all the unwanted tendencies, behaviors, lots of sexual desires nowadays youngsters have. Because of this, there are so much of rape cases and all. But if they have attained this Yama, they have learned the technique of Yama, they will have control over those desires. Niyama, where meditation infuse you with lots of noble and good qualities. Asana, as I discussed the different postures that we attain, but asana, the word actually is meant for the posture that you attain during meditation, that is the lotus pose. Then comes your pranayama, where you learn to regulate and stabilize the energy filled within by doing breathing exercises. Pratyahara is a turning of our attention away from external pull and turning all your consciousness within. Dharana is the flow of thought towards the goal. And dhyana is all about meditation. And combining all these is all about yoga. So in Heartfulness, which I'm practicing, which is totally a non-profitable organization where hardly, I am here from 20 years and none of them has asked me a single penny of money. So it is totally a free of cost institute. So Heartfulness system, they tell that when you meditate, because in meditation we practice pranahuti sakti, which is a spiritual essence that we practice, which is very unique for Heartfulness. Yama, niyama, asana, pranayama, pratyahara, dharana, dhyana, samadhi, all you can do on the same meditation. You get the benefit of all these 8 Ashtanga yoga. So meditation in due course leads you to the concentrated state of samadhi and you are totally into a different world. That's all I have to say for today. Thank you so much.
Thank you very much, Dr. Goyal, for this presentation. For a minute, these are Dr. Sheetal Goyal's coordinates. You can have a look at them. She is available at the Guwahati hospitals, and these are coordinates. This entire presentation that she has made, the video, the edited video, will be there on the Seniors Today website on Monday. So you can refer to that. You can refer to the entire presentation, and you will also get her coordinates that are there. And yes, and if you would like to get in touch with her, you can always do that. Thank you very much. Thank you very much, Dr. Goyal, for this presentation. For a minute, you were with us on 22nd April for a session as a neurologist.
Yeah.
And for those of you who may not have been there, I'm going to put on the chat window a link to the last session that was there, so you can have a look at that. And so for a minute, I didn't even think that you were a neurologist. You were, speaking so much about yoga and so well that it didn't look as if there was a day job that you had. But tell me, Doctor, before I take questions that are there, how much time do you give to yoga yourself every day?
See, I start my day with morning meditation. Definitely, see, like I have been in a medical career, so many a time I have to miss my morning meditation because of my exams, my night duties. So whenever I'm in emergencies, but definitely whenever I have a time, I never miss my morning meditation. And the evening cleaning process that I have been taught through heartfulness, I also emphasize whenever anyone comes to learn meditation, I always say that cleaning is the heart to your meditation. Because everyone will be very astonished. I'm talking very not like neurologist, but I'll just tell you, like how we are taught is that, no, today I'm here as a yoga instructor, so take me like that. So it is told that there is a glass full of water or something, and you want to pour a milk on it, then the milk will just spill off. It will not go inside the glass because you're already full with lots of thoughts, your activities. He said this, that said this, I have to do this, so many things. So, when you meditate, you should be empty from within to accept the grace of the divine light, right? So what we do is that in the evening, we have a process of cleaning. What we do is that we think that all the grossness or whatever activities I did, both good and bad, both of them are just getting removed, and my energy field, which is full of so much of activities, are just getting removed, and I'm becoming very light. And this process we do for 20 to 30 minutes, and this helped me to become empty of all the activities that I have done from morning to evening in my hospital or wherever you all are there. Then when you sit for the morning meditation, that the divine light entry becomes very easy. You feel it. It's not this, I'm just telling it, you feel it. Yeah.
Tell me, doctor, as a neurologist who has been practicing for so many years, and as a yoga practitioner, and an instructor as well, have you seen cases neurological cases, and I know it's an unfair question to ask you.
No, please.
But have there been any cases which have been solved, as a neurologist you found, well, this is a tough case, but thanks to the yoga that you taught, or the person may have learned it by herself or himself, a fairly serious problem got solved?
See, I'll tell you one thing. If you carefully see anyone's disease, many a time, I have to sit with them half an hour just to counsel them. So sometimes the diseases are this small, but the thought process associated with that disease is this big. So, when I give them this idea of meditation and all, so next time when they come, they don't come with this big problem. They come with actual problem to me. So this way, patient really get help with yoga, because yoga and all calm you down. So the extra that you gave anxiety, that stress, that worsened the already underlying condition usually calms down. So I have to deal with only that 20%, which is the actual problem of the patient. So I really feel like every of my patients should undergo yoga.
Right. Doctor, we have a few questions that have come in, and I know we are at 5:40 already, but I'll just ask a few questions, one is by Mr. Sanjay Mehta. and the other by Meeta Bhavsar. Both of them asking for specific. Sanjay Mehta is asking what is the best pranayam patient for a patient suffering from asthma? And for Meeta Bhavsar, it is which asana is helpful for seizure patients?
Okay. And see, regarding your asthma, no, see, firstly, as a doctor, I will talk to you. Asthma is something which doesn't, normally when you will do your X-ray lung or HRCT lung or CCT lung or anything, your lung will be absolutely clean. There will be no finding. It will look like a normal lung. It is only the episodic spasms that comes, that is triggered by certain allergic conditions that you have. So I personally feel that Surya Namaskara and all will help you with that allergic state, because it will boost your immunity and it will prevent that allergic attack of asthma again and again. Regarding pranayama, breathing exercise, any of the breathing exercise will help you. Surya Nari, Chandra Nari exercise, or even both of them will equally help you in asthma. So asthma doesn't have any contraindication for any kind of pranayama, and all the pranayama, there is no specific pranayama that usually I tell for my patient with asthma. I always say that it is all about your Surya Namaskara, which will really help you, because morning exercise will really help for the lung healthiness. Yeah.
Doctor, since you spoke about Surya Namaskar, we have a question from Mr. Sudhir Srivastav, who's 64. Says, can persons with high BP and heart issues do Surya Namaskar?
Yeah, they can do. They can do. See, I'm telling you again, what sometimes you see now, if I say that you have to bend totally, but your body is not allowing you because of your age or your spondylosis. So to whatever extent you can bend, it is not necessary that you have to do exactly the way it is been told. You can modify it according to your bodily requirement. So Surya Namaskara definitely works on BP. It is really a very helpful exercise for controlling the BP.
Right, thank you. And another question from Mr. Srivastav is he's saying his wife, 56, had undergone hernia surgery thrice. Supraumbilical hernia repair with only mesh plastic in 2014. Exploratory laparotomy, RA of gangrene, small bowel, omentectomy of gangrenous omentum, reduction of strangulation hernia was done in 2017. Can she do yoga exercises involving the stomach, like lying on the stomach?
No, not advisable. Not advisable. You cannot give pressure over your stomach. Means whatever, if you lie down prone, it will give pressure over your entire intestine, small intestine. And with so much of complications, it is not advisable to do any exercise where you have to lie down prone.
In fact, I must alert our viewers here and those who are going to be watching it later, is that if you do have a medical condition, it's always good to consult your doctor before even getting into something like yoga, because obviously your doctor knows best for what should be done. Dr. Meeta Bhavsar is asking, which is the specific asana for a seizure patient?
I don't know.
Okay, she will, she is there. No. Suresh Khate, who's 71, he says he has 1 year back, he has undergone open heart valve replacement surgery. What asanas and breathing exercises are useful for him?
See, those who have cardiac disorders, no, they usually undergo this dopamine stress test and all. So many of the asanas are no for them. Many of the asanas which will increase their cardiac output. You see, there's a lots of difference. That's why I say all individuals are different. If like normally what we'll say to individuals, young people do cardiac exercise. People will go spend money to learn cardiac exercise. They will be doing day in, day out. But those who are cardiac patients, no, any exercise that increases their cardiac output is not advisable. So those who has gone, there's already they have a very poor supply of blood in the heart. So if they go for all these asanas, no, the asanas which will cause their increased breathing or increased cardiac output is a big no for them. They should be very careful while doing all this exercise.
Right. Thank you. We have a question from an anonymous attendee who says, I'm losing muscle tone of my leg muscles. Which asana can help me regain the muscle tone?
Many. You can, you have to know which kind of tone, in which muscle the tone has got loss. Like if it is a leg muscle tone, so what you can do, you can carry weight in your leg and you can do exercise, then the tone will itself come. Actually, I mean that when they're saying about tone, they actually mean not neurologically, but they mean that the looseness, flabbiness of the leg.
Right.
So, when you put carry a weight and you do it, no, where even if you're losing tone in your hand and you carry some weight and you do it. So wherever you're losing the tone, that same muscle, if you do overactivity, the tone will come back. I'm not saying come back, but it will improve. Yes.
Doctor, I knew we would be getting into this, but we have quite a few questions which are coming for specific asanas. So I'll just tell you, and you can perhaps give a general reply. Vahar Goradia, who's 77, he has hearing deficiency, and he wants to know if asana can help him. And are there any asanas for stomach muscles? Mr. or Ms. Rao, say any specific yoga exercise to tackle muscle cramps? And Sushil Kumar, who is 75, which asanas for high BP and for diabetes?
Regarding high BP and diabetes, I've already told, because I felt like this is the most common complaint that everyone has. So I dealt with that. Regarding muscle cramps, no, you have to stand. You have to use this. You have to go high up, full straighten, and you have to try the stretch, that maximum stretch that you can do, and put your try to stand in your toes. When you stretch all over, no, it has worked really very good for muscle cramps. And obviously, see, if there is some nutritional deficiency which is causing cramps, my asana will not work. You have to also work on that part, that which deficiency is causing the cramps. Sometimes muscle enzymes like levocarnitin deficiency can cause muscle cramps. So you have to also look after that, and you also have to take tablets for that. But this is the best asana for cramps. You have to go straight, pull yourself up, and try to stand on your toes as much as you can.
Right. Thank you very much, Doctor, for all the responses and for this amazing presentation that you have had. And thank you for taking time out on a Saturday evening for this presentation. And I know you are in your chamber at the hospital right now. And
I just completed my OPD, just 5-10 minutes back.
And thank you very much. Thank you very much once again. And thank you to Wockhardt Hospitals to facilitate this. Before you go, Doctor, I'm going to ask our producer to take us through the latest issue of Seniors Today magazine that has just been published on the 15th of June. As the presentation is being made, I will also talk to you about the magazine. So this is an issue which is just out, which is our 48th issue, and next month is our anniversary issue. As the presentation starts, I'm going to talk to you about some interesting content. Is the presentation ready? An interesting article on how people can talk about it. This is a fun on King Charles. Point of view on say these things instead of story. Something on the dangers of an expanding belly. We have our columnist, a very interesting and engaging story. An article on Kashmir. This is talking about Tina Turner, who passed away, and Ufi Paintal, the Shakuni Mama who was there in Mahabharata, is a tribute to him. So this is where we were, where we are on the June 15th issue. It's there on the website, as always, free of cost, and you can read this as well as the last, all the 48 issues that have been published so far. You can get them on the Seniors Today website. Thank you very much once again, Dr. Sheetal Goyal, for this issue. And thank you to all of you. We will be back once again next Saturday at 5 p.m. with another session of Health Live at Seniors Today. Thank you once again.
Okay, thank you so much.
subscribe now and press the bell icon. Never miss an update.